Extremely emotional, stressful job.
We are fighters. Surgeons are fighters. I knew the real meaning and definition of burnt out after becoming a surgeon. We are burnt out.
You remember your first surgery?
Yes, I do. Yeah.
How was your experience?
I felt really, like...
What is the high performance mindset?
High performance mindset. High performance.
So during doing your med school, did you go through a burnout?
Of course, yeah, you do. Especially, I guess it was the mental burnout, mostly. Mentally I was burnt out by the fact sometimes you cannot solve issues, you cannot convince people, when I was student representative. But burnout by the studying, yes, of course, everybody passed through that stage. But I guess I knew the real meaning and definition of burnt out. It's after being a real doctor and after, becoming a surgeon. We are burnt out and we know how to cope with that, basically. I work until the max. Then I start slowing down when I start realizing that I'm now becoming, like a bit nervous. I can't perform well. Then I know this is the stage where stop, Nooreen. You should just relax, take a leave for a week, and come back again with the energy. So, with time, you get to know how you are coping with your burnout, Sometimes it's just sitting with your friends for a lunch or dinner, you can relieve that burnout, So I didn't realize burnt out, the meaning of it during the medical school. It was more during, our professional life. Yeah.
So how do you fill up your cup? So two things.
Yeah.
Physically,
yes.
How do you maintain having good energy?
Mm-hmm.
And then we'll get to the mentally later. But for physically having energy throughout the day, what do you do?
Physically, when it comes to us as a profession, being in surgical department, where we keep moving, it's non-stop movement,
You're always on your feet.
Yes, because we do surgeries, we do clinics, we do, a lot of, rounding on the patient's day and before you leave. So the whole time, I know this is not an exercise because we keep just, like walking, sometimes maybe. And
standing for very
yes,
long hours.
Yes, and standing for very long hours. We do wear our, compression stockings during our long surgeries, especially when we do transplants. But again, I guess it's the stress which is killing us from inside and keeping us very well, and we don't gain a lot of weight. But I do maintain it as well after working hours. I do go to the gym, and I don't go there just to strengthen myself. I just feel so energetic afterwards. So after going to the gym, I used to finish my work, then go to the gym directly, and I just feel energetic to continue my day. I finish the gym, then I take a shower. Even in the gym, I take a shower, I change, and then I go to my meetings. I continue my day, and I do everything. So physically, I maintain it that way.
You do
basically.
it during
working
your
days.
day.
Yeah. During my working days, if I'm not operating or I finish my operations quite early, then I do go and maintain it. Yeah, it's been only this half a year since I became, the president of the society. I couldn't go to the gym because I'm running here and there with a lot of meetings, a lot of stuff that we're doing for the society. So I cannot find the time. But now, once everything got established in a good way, so now I want to just go back to that routine, basically.
And nutrition-wise, what do you do to maintain good energy?
And don't ask a doctor about nutrition. We are the worst people ever. We are the worst people ever. I start my day with Americano, and then, then we don't even have breakfast most of the time. We just have, lunch afterwards, after working hours. And if it was a lunch with my friends or at home, it's just the regular, Omani kind of lunch. And then probably afterwards the dinner. But we do, when we spend a lot of time at work, or we are on call, then we do use a lot of junky food because we order, especially like sometimes we finish operating, when we do transplants, we finish operating like by 7, 8 p.m. at night. Then at that time, we just go kind of celebrate the day. So we go and have something, junk food, like mashawi or pizza or anything. So yes, our lifestyle when it comes to food, it's not that great, but it's always fixable. I believe some of the doctors, they are quite healthy when they eat. But for me, I try to maintain sometimes maintain, sometimes when I'm nervous, I'm that kind of people. When I'm stressed, I do, junk and on carbs basically mostly. So, and then when I became quiet, during like my vacation, then I eat, very healthy. It's always related to my hormones, like the more stress hormones are there, the more,
the pizza looks nicer.
The pizza slices are there. So, yeah, that is when it comes to nutrition.
And mentally, to continue, like having energy, having room to... Because this is a very extremely emotional, stressful job.
It is stressful job, but... at the end, alhamdulillah, I got very supportive family to start with. Very supportive family. So, yes, my mom is always concerned that I'm late, I'm in operating and stuff like that, but she does understand. My dad is the kindest person on earth, basically. So they do understand that I have selected this path, and that's why they are always, beside me. My daughter is complaining right now, she's a teenage, so she does complain, why you are a surgeon all the time? Then I'm like, because you inspired me, you are the reason. You inspired me, you are the reason for that. And the best thing out of this, it's my friends. I do have very supportive, good friends, my colleagues, very supportive. So whenever I'm facing a bad time at work, then I'm like, hey, backbones, are you here? Then they're like, yes, we're around. Let's go for lunch. So you can just get relief throughout lunch. Just vent it out, Vent it out, talk about whatever you pass through, get the advice from your closer colleagues and friends. And that's it. I feel very good around them. So my family, my friends, they've been always supportive. Mentally, I feel very good around them. And that is the way I get relieved. And beside that, taking, break. We don't take long breaks when it comes to most of the surgeons. We don't take a 1 month, 2 months. We usually, when we are, going abroad somewhere for a vacation or something, then we might take 2 weeks leave or otherwise.
But that's how often?
That's maybe twice a year. But that is not because we don't have leaves. We do have a lot of leaves, The people keep telling us, you have 90 days, just use them. So it's just our work vibe, We feel like we're so committed that the patients, will be late. I'll be late for my patients. A lot of clinics will be, bombarded to a lot of other people or...
and we're always having shortage.
Yeah, I don't know. Is it the vibe of the surgeons? I don't know. Is it our vibe like this? Because I do see it even with my colleagues, It's not only me. So we don't take a lot of leaves. But when we, face a lot of, stressors and we're feeling tired and exhausted, that's the good thing about it, that we'll just tell them, okay, stop. I just need a break. And then I go for a week like a break. So I do that all the time. When I feel I'm overwhelmed, then I do take a break. When I feel that there is something coming up for the society, like a big campaign or something, then I do take 2-3 days, prepare for it, and just, focus. Just to get focused, on a certain area and do it. So that is the way, basically, we relieve ourselves mentally. Yeah.
And you guys have the craziest schedules. And
yeah, of course.
So what tools do you use to plan and schedule your days?
So So we do still, again, at the end, it's not like I'm operating every day. We do have certain days like operating because, the operating rooms are limited, and there are a lot of surgeons. So certain days you are operating, certain days you are, doing clinics. Other days you are kind of engaged in a lot of quality meetings because we are engaged with a lot of, meetings inside the hospital, even outside the hospital at the level of ministry. We are trainers as well for the Oman Surgical Specialty Board, the junior residents who are in the surgical program. So we are, involved in teaching as well, teaching the medical students because I'm a Royal Hospital based, it's a teaching hospital. So it's, even when you come at a day where you don't have clinic or you are not operating, definitely there will be something that you're doing, that day, whether you are engaged with this or checking a referral or somebody's calling you from another hospital to consult you. So we're always busy. Yeah.
And usually, how far ahead do you plan, like for yourself, aside from your work schedule?
Yes.
But your own personal life, like how ahead do you plan?
Maybe the night before.
Okay.
I'm going for a vacation. No, sometimes, yes, we do plan certain stuff. Like if I'm going abroad, then yes, I do plan it ahead. But other plans, like I love sudden plans.
Okay.
People saying,
like
tonight, let's go to
spontaneous,
cinema. Yeah, let's go to cinema. Okay, tonight you're invited for dinner. Oh, okay, let's go for dinner. Okay.
Was that forced upon you because of your job?
So. Yeah, I guess so, yeah.
Because you're always on call. So you're like, no, actually I like spontaneous.
Exactly.
But actually you don't have a choice but to be spontaneous.
No, it's just we're engaged, Sometimes, my specialty as being liver, pancreas, and transplant surgeon, we do, cancer cases and we do transplant. So it's quite very long procedures, So usually we finish them quite late,
How many hours?
Like certain cases, you can finish them in 2 hours. Other cases, you might finish them in 4 hours. Transplant, sometimes 8 hours, So it depends on, the type of cancer you're doing, how big it is, whether it's invading other stuff. So it's there is no strict rule that you are going, for a surgery for, I can't say like it's 1 hour. Sometimes you might go in and find a lot of stuff are happening there. So a lot of my specialty, by default, it's complicated. So that's why we spend a lot of hours operating. So when we finish operating that day, it's a lot of energy and stress, and even when we finish late, sometimes I do stay behind. If I finish like let's say by 5, I do stay behind to make sure that the patient by 8 o'clock, just passing through the patient, he's doing well after the surgery, especially if it was a big surgery like cancer case. So I do stay behind, check the patient during the weekends. Like Friday, Saturday, I do come all the way to the hospital, just to check my patient, even if I have 2 or 3 patients. So I go there, check on them, especially So by default, it depends what kind of cases you're doing, what kind of, big cases, you're dealing with. Then we know that we are engaged. So my family, sometimes they become disturbed, like during the weekend, if you're not having breakfast with us, but I'm like, yeah, sure, I'll just go for 1 hour and just come back, and I'll spend.
Why does it matter in the weekend, let's say, to go and check on your patients?
Because, in Royal, it's a big center, The on-call team cannot see the whole 60 patients in the service.
During the weekdays,
yes, so they cannot see the on-call people. There are like 3 people who are, on-call. And it's not like other specialties. They are operating these people, so they might be operating in the OR. So who would see our patients, So, and people must be seen. Patients must be seen every day. I don't know, this is our way here, Like we do care about our patients and the quality and the service we're providing to them, especially when it comes to big surgeries. Sometimes even one day, it does matter, if you didn't examine him, if you didn't make sure that all the investigations are good and everything is good. So seeing them keeps me relaxed the whole day, that
Yeah, and
day.
I think also it makes the
Yes.
patients also.
Yes. And sometimes if there are people from your team who are on call during that weekend, then they would see the patients and
Okay.
just update you. So while you are relaxed at home. So yeah, and sometimes you might be on call during the weekend, basically the whole weekend. So yeah, it's a busy life, but again, it's less busy than the time when we were at training, when we were residents, because during residency there is more, reading, there is more, performance, there is more on calls, more responsibility on them. So it's more busier during residency life. It's quite tough those 5 years when you do your surgical specialty. But during, when you are consultant, then you are just concerned about your patients, not the whole hospital, just your patients. And the responsibility, of course, would become bigger because these are your patients. But again, it's a bit quite relaxed compared to residency program.
What are the things you feel developed in you during residency?
During residency, hardworking.
Because, I mean, it was
Yes.
a challenge. You're not used to that
Yes.
pressure. So how did
Yes.
you adapt? And what did you learn?
Yes, it was very tough because it was, throughout, like my daughter got operated in the first year during my residency. So I was trying to cope between this and this being a mother for my daughter, making sure that she's fine, especially in the first 2 years after surgery, and having the surgical residency program. But the interesting thing that I was really doing very well at my residency program, because I felt that I don't want to look, less than the others because I have a sick kid, I was always determined, no, I am the best and I'll be the best, and I'm going to a difficult specialty. I have to prove myself. Okay, who would send me to such a difficult program and challenging program abroad unless you prove yourself that you are a very good resident there? So I did that. I did manage, and just being dedicated, hardworking, reading a lot. Knowledge is so powerful. When you are knowledgeable throughout residency program, it's so powerful because skills you might develop it even later on. While doing the fellowships and afterwards. But
Like aside from doing the surgeries and all that,
Yeah.
how many hours you had to read?
Reading throughout the residency program, you mean?
Yeah, what would the schedule look like in a normal day?
In a normal day for a resident,
Yeah.
he would wake up at 5. He should show up at 5:30, 6 o'clock to the before everyone. Before the consultant comes at 7:30, because they have to know everything about the patients, even their hemoglobin, not today even yesterday, and compare it. Okay, so to that extent, to that extent, our surgical specialty became very well structured here in Oman. So people would ask us and grill us if we didn't know, what is the level of hemoglobin, what is the level of his count, what is his drain output today, how much urine he put yesterday. So the consultants will be concerned about every single detail. They're not supposed to know it. They're supposed to know it through the residents, and that is the way they would know that this resident is on everything and knows everything about the patient. And, and at that stage, you develop your leadership because you are deciding for the patients and you tell your plan to the consultant. I'm planning to do a CT scan for this patient because of this and this and that. And then he would say, yes, excellent, move on. So, and then, you get engaged in the operation theaters if you are operating. Then if you are on call, you continue the day by on call. Usually the consultant would leave by 2:30, 3 o'clock maximum if he's not operating. But the resident stays behind because he has to do the round. He has to make sure that everything is executed. And most of the time they might leave by 4, 5 o'clock. In the university, because the work finishes at 4, we used to leave by 6, 7 p.m. So that is the residency life, the real residency life, basically. During the weekends, we do read, we have exams coming, and whatever we face throughout that week, let's say I faced colon cancer or whatever, or a person who came with a dead bowel, then I do read about it. How do you manage it? What do you do? So afterwards, the more cases comes on the way, then you study. We do a lot of group studying. So every batch, there used to be like, grouping together, like the 5th year, surgical residents, they are all together, the 4th year all together. So they do grouping. And my best friends until now, they are my group, basically, who started with me like 13 years back. So we do group, we do a lot of, study together. And we pass through it,
You said, but it's like a different challenge for being a woman and a surgeon?
Yes, because, we used to be, it was male-dominated, specialty.
Is it just that you're talking about liver transplant or
and everything? Liver transplant, you're talking then about rare thing even, like a woman goes into transplant. But even like a surgical specialty, even general surgery, to become a general surgeon after those 5 years, it was more like male-dominated, specialties. And then afterwards, when a lot of Omanis came and, there were a lot of females who came, from Canadian training as well. They were, females should come and they should have the same opportunity like the males. So at the beginning, they chose equivalent number, like let's say 6 males, 6 females. And then afterwards, they decided, no, we're not going to choose based on that. We're going to choose based on who passes the interview with a very good quality person.
Yeah, that makes more sense.
Yes. So then they've chosen those factors. And now the whole surgical residency program, 70% are females. Because by default, females are very hardworking at medical school. They score, more. There are a lot of males, but it's more like, the girls are well determined.
There's more female doctors in Oman.
Yes. No, you can't say that.
No?
Yeah, it's like equivalent number when they enter the medical school. They choose like equivalent number.
So in terms of, you mean giving scholarship, they would give equal?
Yes, scholarship is equal to.
Okay.
Yes, so like in my batch, there were like 70 females, 70 males.
Nice.
Yes, and the grade of the least person, like in female, it was like 98.5%, and the least grade between the males, like it would be like 95 or 94. So it doesn't matter your grade there, okay? So the 97 girl would not go in, and the 95% would go in the male, because they wanted to choose, equal number of people entering the medical school. But now, in the surgical field got changed, flipped. So people chose the best quality of people who are entering, and luckily we got more females. So in the surgical residency
I think that
program,
makes more sense, because regardless whether it's a male or female, you want someone who's more qualified or more capable.
More capable. And I don't want my male colleagues to become sensitive about it, but these studies are showing now that, like females are more determined, and the quality of care and patient satisfaction are more with the female surgeons. I know they would be complaining about this when I say it, but yes, the studies have shown, not me. So... Yeah.
Is it? Do you feel this is only with the surgeons or
everybody,
in general, women are more hardworking?
These studies were done on surgeons, but in general, I feel we females by nature, we care about everything.
But there's more female than male. Like there's more women than men. Statistically, number-wise, there's more women, right?
No, it's the same number. It's like you would go to certain specialties that are more males.
Actually, they're giving.
Yeah. Like you would go to, for example, orthopedic, okay? So bone surgeons, they're more males, okay? You would go to, for example, eye surgeons. They're more males than females.
So it depends on the field.
So it depends on the field, depends on the, specialty. So even by now, even male are still dominating the surgical field. When it comes to consultant level, it's still male, like mostly. But now we're more accepting kind of like females in the surgical residency program. So in the future, probably we're hitting all the floors, all female surgeons. Yeah, yeah.
Another thing I wanted to ask you. Yes, going back to your childhood.
Yes.
You said that, because it was just you and your brother,
Yes.
so you always wanted to have more friends.
Yes.
And
exactly.
whether within the family or outside the family.
Yeah.
And you said that your social behavior kept reshaping.
Yes. So, because, not having a lot of sisters around, and I had just one brother. So I guess that what made me more social with the other people, because I wanted somebody in my life, a lot of girls, So that made me very, very social with the other people and started trusting them quite fast,
Yeah.
Yeah, so, and I've learned from every experience and every person, a lot of stuff. So, and then I guess every experience you pass through, it always, somehow...
Has an impact.
Yeah, it has an impact and it reshapes your personality, to a certain level. Yeah, beside the genes and the traits and the way you were raised, of course. Yeah.
Yeah, and you want to get accepted
Exactly.
in this group.
Yes, yes. And I've been always not accepted except through the nerdy groups, Yeah, so, yeah. That was weird, but I had a very limited number of like friends. I was social and I was very nice to everybody, but very close people around me, very limited, yes. Yeah, during school time. Yeah.
So now what do you advise your daughter, like how to go about it?
She's facing a lot of issues. She's like her mother. She got very strong leadership and personality.
Mashallah.
And people around her, they get very scared. I can see the way she talks about her friends. And she keeps telling me, they don't want to be my friends. And in certain fields, she at certain stage and certain age, she got some issues regarding, she's wearing scarf. And the girls told her, why you were wearing scarf? So, and she lost some of her friends, which was very weird. But, kids at school and teenage, they think in a different way. They're not like us. It's an effect of social media nowadays. So, but I always give her, advices. I always tell her, you would find your best friends during the college and during, later on in your life. Those are the friends that will, stay with you forever, probably. So just be patient, be nice to everyone, get everyone, close to you. And your best friend, you will get her definitely at one stage. Yeah, I keep telling her, they're kids. Yeah.
And I was laughing while I was preparing this question. But what are misconceptions people have about surgeons? Or you had, let's say, about surgeons before and after? Or people have...
Misconceptions about surgeons. Ego. Okay? So they keep telling us that you have a lot of ego. And we don't consider it as ego. We consider it as being determined, and for surgeons... it's always like we can't accept the stuff which are running in not a good way. I would say we can't accept it in a quiet way. For example, we keep fighting with the emergency people. Dumping patients on our service without proper, for example, sometimes working them up, or the medical team. They don't accept such people and they, dump them to our service, or they don't come to CP. So people, they always tell us, you have a lot of ego and you come and fight. Yes, we do. We are fighters. Surgeons are fighters, and we do fight for our patients a lot, And I guess that is something, it comes from our specialty and our, the way we were raised in surgery, like, we always have, A and B and C, like we should follow pathway, we should
have an
follow
order.
Algorithm, and we should follow the order in order to get the best outcome for the patient,
Which is a bit challenging with our culture, I think. We're not used to a lot of...
And they were like, but your people, they come and they talk to us in a very bad way. I'm like, we are raising these junior residents, to become determined, to know what they are doing, and we're sorry. Sometimes, if we are asking to do an ultrasound, then ultrasound should be done. If we are asking to, sometimes like even with our nice colleagues radiologists, they were like, why you want it right now? Because, they cannot understand that, for
It's
us,
critical.
sometimes it's the matter of hours, it's the matter of minutes that we make our decision. Shall I take this patient to the operating theater or not? Shall I sit on him and keep quiet the whole night, or just be, super fast and just trying to... Because at the end, sometimes you are limited with your resources. You are limited with your operating time. You are limited with... So they don't see those stressors which are around us. If I kept and slept on this patient, he might lose his life. Okay? He might have sepsis and a lot of infections going on, and he might lose his life. So that's why, surgeons are always, efficient when it comes to timing, and when it comes to, diagnosing the patient. We want everything to be done, properly, not to sit on stuff, because we want to finish it. And that is our culture as well, Like people come during the on-call, 7 appendices, appendix here, and there is a person with infection and pus coming here. There is a person who needs toe amputation here, and there is a person. So it's a lot of cases coming throughout, one day, and you are operating the whole day and the whole night, on these 7, 8 patients. Sometimes you're non-stop in the operating theater until the next day morning. And if you have another operation the next day morning, like your elective list, then you're continuing that operation. So how you would feel about, the personality of a surgeon? It's a lot of stuff that has to move in a right way, in a right direction, because we can't just dump the people at the service and just let them, they do nothing and work them, day by day, and utilize that bed where I can bring another patient and just work him fast and operate on him and just leave the hospital. So that is a misconception. They always tell us, you have a lot of ego, all of you. So,
but you're actually trying to manage your resources.
Yes. I wouldn't say sometimes, maybe, probably, some people, they might not approach the other person in a good way. And sometimes because we are burnt out, from, there's something which keeps happening and recurrent and you can't fix it anymore, then we're kind of,
frustrated.
Yes, frustrated about it.
All.
Yes. Then we're frustrated about it, It's not the surgeons only. It's anybody who deals with, with any matter and business that needs, to get recovered and solved quite fast. So that is the way I would see it. That is one of the misconceptions, basically, about the surgeons.
You remember your first surgery?
Yes, I do.
Was it this is during training?
During my medical school.
Yeah.
Not training. During my medical school, I was 5th year medical student, and I did my first appendectomy. Yes.
Okay.
Yeah.
How was your experience?
It was great. I felt really, super powerful, like I become the consultant the next day, I was just student. I felt really great about it.
Was it the same experience with other doctors, or they had a different experience with their first surgery?
I don't recall, but, everybody who's interested in surgery, they would always do that quite early, like when they are students, because you want to be known, you want to show them that you're passionate so you can enter the
does it happen because some people are not comfortable with the whole opening and cutting and...
Yes. Some people, of course. Some
people are I'm going to do this and I'm going to become... And then basically. They go there and...
Yes, some people faint, basically. In the operating theater, yes, they do. They do faint, in the operating theater. And... yes, it did happen quite a lot.
How?
Once they see the blood, they just faint.
This is the doctor.
Doctors, especially medical students.
Does it make them want to puke, or is it just feeling lightheaded? I'm feeling dizzy.
Yes, lightheaded, dizzy. Then we do realize. Then we tell everybody.
And this could be any part of the body, or only certain complicated. Cases.
Sometimes, by just they see inside, they might become lightheaded, but most of the time with the blood, that they might become, lightheaded. When
And they
see
couldn't see
bleeding.
this in themselves before.
No, because this will happen if somebody had this, then you would see that they would avoid going to the operating theater the next time. So they would tell the surgeon, I can become lightheaded. And we just encourage them, come, just stay behind, just look at the screen. For example, if we are performing laparoscopic procedure, for example.
So after that, what's another path do they take if they can't proceed becoming the actual surgeon?
No, most of these people who faint and stuff like that, they're not surgeon, and they will not take this path. They will just go, they were like, no, we can't tolerate surgery. Those people usually who like surgery, you would see them coming, not only observing, they would come scrub. They would ask the surgeon, can I scrub? Can I wear the gowns and come in the field? Then you would know that this is a guy who's
They're
interested.
comfortable,
Yeah.
I remember as kids, my cousin he's a photographer, but he would enjoy watching surgeries when we were kids.
Okay.
And I felt that very weird, and I was like, I wasn't comfortable. I'm like, what are we doing?
Yeah.
I don't see anything exciting about seeing, some fat and some
exactly.
blood and veins and no. So
it's just different perception by
yeah,
everyone.
he was enjoying. It's like
I would tell you something, and I'm pretty sure you would laugh. I just discovered that seeing and looking at blood is so just emotional thing. Because when I see blood coming from my daughter because she's injured or something,
it's
or
different.
my mother, it's different. I get lightheaded.
Okay.
I get nauseated and lightheaded. Then I just discovered the bleeding is something, emotional. It's connected to the person. Like I do see blood every day. I'm operating, and I don't get anything. But when I see it from my daughter, I just get lightheaded and I don't feel well. So
that's different, huh?
That is different. It's just emotional, I guess it's just emotional. This is what I discovered. I'll do a study about it.
It's not psychological. It's just
I don't know. I feel it's just something emotional related to that person, whether he's
what's the
your relative or
connection with that
something.
person?
Yeah. What's the connection with that person? And that's why we always say, you don't operate on relatives. The surgeon, they don't operate on relative ethically. Because anything might happen there.
And might affect the decision making.
Yes, it might affect the decision making. It might affect you during the surgery. So you better not operate on them and stay aside. Not even go to the operating theater. Yeah.
And talking about pancreas and the liver, so what's their roles? And then we'll discuss further.
My lovely organ is the pancreas, I would say, more than the liver.
Oh, poor liver.
I love the pancreas, and it's so complicated organ. So complicated. Anybody who's having any issue with the pancreas, it's like a nightmare. All the surgeons, they are scared of the pancreas. It's like an organ which is protected by God behind the stomach. Nothing can touches it. And if there is an inflammation in it or something in it, then, that...
So it's complicated.
Yes.
What's the role of it?
It produces a lot of, hormones that helps in digesting your food, beside your insulin, beside your blood sugar, it controls it. So pancreas, it's very spongy, it's like very spongy, very soft, and when it gets affected, all those secretions can go to the body and destroy the organs, because it's very alkali solution, so it can destroy everything. And I don't know, I'm so fascinated by it. I love it. Somehow I just love it. I love doing pancreas surgeries.
And what affects its health? Like, how do you damage it, and then what do you do to?
Like when it comes to
take
my
better
specialty, it's
health?
almost cancer. Cancer. We deal with a lot of cancers in the pancreas, and alcohol can destroy it as well. It can cause a lot of inflammation there. Gallstones sometimes, when you have gallbladder stones, then those stones might migrate and cause inflammation in the pancreas. Those are like the commonest kind of condition that the pancreas might suffer from. Sometimes, people get, diabetes because of certain resistance to the insulin, whether it's, weight related or whether it's something genetic. But most of the time, we surgeons deal with the pancreas for tumors, basically. So tumors are there, then we go and resect them. Or there's an inflammation with a lot of fluid happening there, then we go and deal with it, basically. Yeah.
Then what can you do, or what can a person do to improve the health of their pancreas?
The pancreas, just eat well, avoid alcohol, avoid smoking, and just be healthy. That's it. Yeah.
Healthy meaning
healthy lifestyle, gymming, doing exercise, and eating well. That is the whole thing. Your whole organs in the body, it needs that. Avoid alcohol, avoid smoking, and eat healthy and exercise. You will maintain the shape of your liver. So you would maintain, you would keep it without fat, because nowadays, we used to do a lot of transplants because of, the virus affecting the liver, we call it hepatitis virus, okay, affecting the liver. It can cause cancers, or, it can damage the liver. And the other reason was alcohol, because it can cause, fatty infiltration there and a lot of changes, and eventually the person can go into, like liver fibrosis. So those were the main reasons. But nowadays we're seeing more of fatty livers, which are, because of lifestyle, because of the diet and obesity, and it can, lead to fibrosis, and eventually we are transplanting those people. So getting, exercising, having a healthy lifestyle, eating well, avoiding alcohol, avoiding, a lot of medications, herbal medications. Sometimes they might damage your liver as well. They might damage your kidneys. And prescribed medications without knowing the appropriate dosage of these medications, it can destroy your liver sometimes. Avoiding all types of toxins which can destroy the liver. Using, when it comes to the virus, how it does spread, using, unsterilized, stuff for shaving or anything, it can disseminate these kind of viruses. So always sterilization is very important in anything. Yeah.
So
I keep talking.
We're learning.
Yeah.
I don't know much about liver and pancreas, but I'm sure most of the audience also.
Yeah,
probably they're better than me.
Yes.
So how can you know, like, your gut health? Like, if it's
if there is
usually what are the red?
If there is
red
anything
alarming
which got changed than the norm, then that is something alarming, okay? And then we say there are certain alarming signs that always would mandate, that the person go and get screened. Like if you're having, a sudden weight loss, which was unplanned, you're not dieting, but you're losing weight, loss of appetite, fever, shivering, especially at nights, sweating a lot, and there are a lot of signs, that are related to certain conditions, but always I would say, like, something got changed from the norm. And like, for example, you're used that, like, you're not, you don't used to have a lot of nausea, then you develop a lot of nausea out of sudden, and a lot of, dyspepsia and burning sensation. And then all of these stuff, are alarming. Yellowish discoloration, when it comes to my specialty, I would say yellowish discoloration of the eyes, of the skin, then that is something really alarming, okay, that something is happening with the liver, or either, the biliary system or the pancreas. So that is something really alarming. These are like the most, common alarming signs that we always tell the people. If you're starting to complain about something sudden, a person who's very well and suddenly he complains of severe back pain. We have a lot of people who are young, who are diagnosed with, pancreas cancer, and they come because just back pain. They don't have yellowish discoloration. They don't have anything else. They might be quite early to lose weight, you know.
And
just the
usually,
back
what
pain.
test would show results that would indicate that
You know, it depends. It depends. Some people, you know, like, for example, if there is a screening program when it comes to ladies, for example, we say from 35 years old, you know, they have to do, you know, a mammogram and examine their breast quite, you know, every time to just check if there is any breast cancer. Then these are stuff which are
And for
important.
men?
And for men, for example, if there is, you know, like we say, it depends on the family and, you know, whether there's something running in the family as
Yeah.
well, you know. For
Totally.
example, if somebody is having colon cancer in the family and it's quite running in the family, then we tell them from the age of 20, 25, or some people even from age 15 if they have like all the brothers got affected. Certain conditions, it depends on whether this is running in the family or whether this is something sporadic just came to this person because of genes or something. So
But let's say a healthy person and they're past 35 years old.
yes, so we would say always, for example, screening the colon. It starts from 40 years old. Then you can screen by doing a colonoscopy or doing even simpler than colonoscopy, doing like
I'm
checking.
sure a lot of men would try and
Yeah.
avoid that.
Yeah, doing like checking the stool if there is blood, for
Okay.
example, in the stool, or the other thing, if you're complaining of a lot of, you know, burning and stuff, then you can get scoped as well or checked for the bacteria as well. CT scan, I wouldn't say like it's a modality that you can just go and do it without having symptoms, but we usually use it if the person came with symptoms. Then we do use it to discover if there is something happening, something wrong.
And usually, let's say for doctors, let's say going through medical school or
Yes.
doing residency, what is the mindset that usually makes them not able to perform high?
You know, some people maybe probably can't cope with the stress a lot.
Why?
It's a lot of study. It's a lot of study. There is a lot of stress when it comes to a lot of studying during medical school, a lot of subjects. Sometimes you might be not open to get the help from the other people, you know, around you, or the lecturers themselves. So you might get in troubles as well. Sometimes I do realize that the factors around you might affect you, your family if they're passing through something, your socioeconomic stuff, and it might affect you somehow. Sometimes, you know, it's not only your performance at the medical school. So certain people, yes, they might not cope with that, and we have a lot of people who change their profession. Basically, they go from medical school to other professions like teacher or engineer or other schools, business. Okay, and then they might find themselves. Some people, they think that they might have loved this, you know, specialty and becoming a doctor, but then somehow it's not because of performance. They just don't like it, you know. When they enter the medical school, they just don't like it. They don't like, what is this, you know?
Yeah, and
studying
it's
all
a
of
very
this, yeah.
demanding field.
It is,
So
of
if you
course.
don't enjoy it,
Yes, it is very demanding. You have to make sure that, you know, you're studying, you know, you're moving, your study doesn't stop, you know, with our 12th grade, you know. It just continues throughout 7 years. It's not only 7 years, then throughout the residency program, then after residency program, the fellowship program. Then when you graduate, when you're 35 years old, then you think that, okay, now we're settled. No, it's not settled. I am a consultant now and I keep reading. It's a life full of reading. We read nonstop, okay, because medicine is a field which keeps changing, okay, every day. And today they treat pancreas cancer in this way with this chemotherapy. Tomorrow there is another regimen and another chemotherapy, another medication, another way of doing the surgery even. So we keep reading. So reading doesn't stop. We keep reading. Probably we don't read the books and the anatomy, what we used to do, because by now we memorized all of that. But we keep reading the other stuff. And the more we become mature, we keep reading the, like the other stuff as well, how you would maintain your health and how you would avoid burnout, and you would enter a lot of workshops when it comes to how you can cope with stress, how you would be, you would. There are a lot of workshops about professionalism as well with us. There are a lot of workshops about leadership, about quality control. When we become consultants, then we are more engaged with such topics, basically, because we're now not only treating patients, we're trying now to follow KPIs and to maintain the quality in this service and to do, kind of lean management and everything. And so we are engaged with a lot of stuff. So every stage comes with its own, like responsibility and with own stuff, how you would, perform and how you would move on and what you would do. Like nowadays, I feel really crazy, between the patients and maintaining all of this, and my role as being a consultant in the unit and to do all the quality control stuff and protocols and guidelines, and then the transplant service because it's new service, and then again the society as well that I'm leading right now. So, but with the help of others, I try always to include the other people and to get the help from the people around. When it comes to my society, I do nowadays, get a lot of volunteers who are helping me from outside medicine, because I feel they are the best people to help me with this campaign. They are very open. They like the subject. They like talking about organ donation. And probably some of them, they pass through it with their families. And the other people, they were just inspired by the stories. So I like getting them involved, basically, because doctors, they are not free to do all of this, So even myself, sometimes, like I would be quiet for a week or two, I get engaged with a lot of stuff and operating, and then I'm back to it, whenever there is a time, I'm back to it. But I make sure the media company is still running everything, and the other stuff, they are running all the kind of, awareness stuff. So, yeah. We have busy life.
Going back to when you went through, let's say, career burnout, you remember what book impacted you, or you listened to a particular person? How did you go about it?
My career.
Do you remember the phase?
No, I do. I'm not like a book person, okay? Probably because I didn't have the time for that. Maybe now when I retire, okay? But I do listen to the people a lot, okay? I do listen to the people.
Like who?
Like I do listen, like very random people when they start talking about, about how to be empowered, about how you can, how you can be a good, successful leader, how you can be a nice humankind, like a kind person. And I do listen to very random stuff from very random people here and there. Okay. And sometimes it's my colleagues, even my like senior colleagues. When they start talking, I love listening to them. Some of them, they got that, that capability, of, talking about stuff in a very different way and inspire you by the way they talk. So yeah, it's mostly, I get to listen to a lot of people who basically tell their stories as well. I love listening to stories. Okay, I became so dramatic and I start crying. So I love listening to stories of people as well. So yeah.
Okay, so from your perspective, what is the high performance mindset?
High performance mindset. High performance. So I believe high performance, it comes from, from experiences, it comes from failures, it comes from beliefs, it comes from from you know, dedication, your, you know, the way you treat people, your work ethics, your teamwork. And it comes from, you know, the way how you're approaching the life and the way how you're coping with it. Okay, I guess all of this can, you know, reshape how, you know, reshape your mindset, you know, and affect it at certain level. Um, um, I can't think about anything else right now, but you know, we talked about a lot of stuff. You know,
For, let's say, a young student in the medical school,
yes.
you feel they have good potential, but they're not very focused. How do you get them to shift gears?
I do encourage them. I tell them, wow, I'm so impressed by you. You're excellent. You know, we're living in a culture where we don't say a lot of thank you and we don't, you know, talk to the people, okay? So people appreciate when you're talking to them. Like a medical student, when a consultant talks to him and says, wow, that is impressive, it means a lot to him, you know? Like it just encourages him, because that was me, at least, you know, when somebody tells me something, then I get pushed, you know, forward. And I can see it in their eyes, you know, these medical students, when you tell them, wow, I'm impressed by your knowledge, you know, like you impressed me today and you even scrubbed in the OR, that's really great. Then you would see him the next day coming, you know, to the OR and, you know, operating with us. Sorry, OR is operating theater. So they come and they perform with us. Then they would come to your clinic and you would see them more frequently. So always communicating with such people, giving them, you know, the encouraging words, and they feel much more relaxed with you. And then they get to you for certain advices. Then we do advise them, you know, you should do your exams, you should, you know, attend all these, you know, courses, seminars, and do more research so you can get easily into this competitive program, because our program is really competitive, you know. We don't accept anybody in it. We accept very high standards people. Even if there is an excellent person, you know, there's an excellent person and who's nerdy, we don't accept him if he's not a good leader, you know. We do care about attitude a lot. We do ask around about this person. How is he? How is his communication skills? Is he arrogant? Is he... So we do ask a lot around this person.
What is considered good attitude?
I mean, good attitude, behaving well, you know, listening to his other colleagues, you know, respecting his seniors. You know, some people would come with a lot of ego, you know, they don't even respect the senior. I'm much better than the consultant. Who are you? You're just medical student. You didn't pass through all these 10 years to get that experience, you know. So certain people, they got that attitude and that ego. So we do, you know, consider all these facts, because at the end, you want to have, we do believe that our specialty, it's a very, you know, demanding, and at the same time, it's a specialty that you need to be very careful while you're dealing with the patients, you know. It's about not only knowledge, it's about cutting the patient as well. It's about skills. So you have to make sure that there is a person who's determined, who's leader, with good attitude, whom the patient would feel very relaxed, you know, to deal with him even, and he can deal with his colleagues as well. You can't perform alone, you know, that is a fact. Especially at an era of subspecialization, you can't perform alone. Nooreen can't perform only alone. She would need definitely the help of her colleague one day. You know, she would need the help of the seniors, senior people who are senior than her. So you need that kind of, you know, good atmosphere and good attitude and communication skills with your colleagues and the people around you. Yeah.
Fantastic. Yeah. Well, talking about thank you, I want to thank you not just for coming on this show, but for sticking to this transplant profession.
Yes.
With the dedication that you're on. I'm sure a lot of families feel more comfortable when they know that you've been through it.
Yes.
and then they can advise them and share with them your own experience, and you can relate even to them
Yes.
better.
Exactly, yes.
So that was a very moving and inspiring story.
So now you will donate your organs?
Inshallah, if we have to.
You have to sign then.
I have to sign
Yeah.
that I shouldn't come and complain later.
Yes, exactly. Exactly, yeah.
Inshallah. Thank you again.
Thank you, Hisham. It
Tashreef.
was really nice chatting with you. I felt like homey really here,
Alhamdulillah.
and I'm really glad that you invited me to talk here today. Thank you.
Fantastic. Shukran.
Thank you.